Hey future nurses! Let's talk about one of the most critical times in postpartum care, the postpartum period, also called the puerperium. This phase lasts about 6 weeks after delivery, and it's when a mother's body starts returning to its pre-pregnancy state. As nurses, you'll be monitoring both physical and psychological changes, so let's break it all down. First up, the body starts changing right after delivery. One of the first signs? Postpartum shivering. The exact cause? Unknown. But here's what you do. Offer a warm blanket and reassure the patient the shivering will pass. Now let's talk reproductive system, specifically uterus involution. After the placenta is delivered, oxytocin continues to be released, helping the uterus contract and shrink. It starts to reduce in size and weight, and the fundus, that's the top of the uterus, becomes firm and midline. It also descends about 1 centimeter per day. And around 1 hour after delivery, it should be palpable right at the umbilicus. Your patient may also feel after pains, especially if they've had multiple pregnancies or while breastfeeding. That's because nipple stimulation triggers oxytocin, which causes the uterus to contract. Make sure to let patients know this is normal, and it gets more noticeable with each pregnancy. Next, we have lochia, a vaginal discharge made of blood, mucus, and tissue. It can last up to 6 weeks, and it changes color as healing progresses. Here's the order: red, then pink, then white. The cervix slowly closes, and by day 14, it's only slightly dilated. The vagina loses tone right after delivery, but in about 4 weeks, the rugae, or folds, begin to reappear. Still, it'll never fully return to its pre-pregnancy size. The perineum. It's usually bruised and swollen, but the muscle tone comes back in 4 to 6 weeks. Ovarian function varies based on breastfeeding. If the mother is not breastfeeding, ovulation may return as early as 27 days postpartum. If she is breastfeeding, ovulation and menstruation may be delayed for weeks or even months. Before milk production starts, the breasts first secrete colostrum. Then, between days 2 and 4, the milk comes in, and yes, the breasts may feel warm, firm, and tender. That's totally normal. If mom isn't planning to breastfeed, she needs intervention to suppress milk production. Skin-wise, stretch marks may fade, but usually don't go away. Linear nigra and melasma. They fade over time. And yes, hair loss is temporary. G-wise, new moms are usually hungry and thirsty, but constipation is common. Make sure stool softeners are available, especially if there are hemorrhoids. Here's the breakdown of normal blood loss. Vaginal delivery, 250 to 500 milliliters. C-section, 800 to 1000 milliliters. Cardiac output spikes right after delivery, but returns to normal within an hour. Because plasma volume drops, hemoglobin and hematocrit temporarily increase. Fibrinogen levels rise, which means a higher risk for blood clots. Also, WBCs, especially neutrophils, can go up to 30,000. That's a normal response to stress and inflammation. Watch for diuresis and sweating as the body gets rid of extra fluid. Breathing returns to normal quickly, and nasal congestion from pregnancy usually clears up fast. Bladder tone is often reduced. That can cause urinary retention or even a UTI. A distended bladder may even displace the uterus, increasing the risk for postpartum hemorrhage. Musculoskeletal-wise, the hormone relaxin starts to fade. Some hip pain may linger for a few days. And keep an eye out for diastasis recti, a separation of the abdominal wall muscles. Whew! That's a lot of postpartum change, but you've got it. As nurses, you're the eyes, ears, and hearts during this delicate phase. Keep learning, stay observant, and always advocate for your patients. You're one step closer to being an amazing nurse. Catch you in the next lesson.